name is Stephanie Alexander, and this is my APN 624 physical exam competency. I'm going to start with the mini mental exam. Can you tell me your name and your birth date?
Missy Cobb, September 21st, 1956.
And what's today's date?
April 21st, 2021.
And where are we?
Home,
And what city and state are we in?
Evansville, Indiana.
Okay, I'm going to name 3 things and have you repeat them back to me. And then here in a minute or so, I'm going to see if you can recall those 3 things. Pair, book, and shoe.
Pair, book, and shoe.
Okay. Can you spell the word world backwards?
DLROW.
Good. And then can you tell me what this is?
Watch.
And this.
Pen.
Can you repeat the phrase no ifs, ands, or buts?
No ifs, ands, or buts.
Okay, and then can you name again the 3 things that I told you earlier?
Pair, book, and shoe.
Good. I'm going to have you take this piece of paper in your right hand, fold it in half, and put it on the floor. I'm going to have you read this piece of paper and do what it says.
Close your eyes.
Okay. Then I'm going to have you write a sentence containing a noun and a verb. Good. Okay, then can you look at this image down here and copy it onto this piece of paper? Good. She scored a 30 out of 30 on the mini mental exam. Next, I'm going to move on to skin assessment. So when you're assessing skin, you're looking at the temperature and texture. You want to look for pink, warm, and dry skin, or any deviations from that, such as cyanosis. You then check the nails for any clubbing or pitting, and check capillary refill, which should be equal then or less to 3 seconds. To assess skin turgor, you pinch up an area of the skin near the clavicle and watch for quick elastic recoil. Next, moving to the scalp, you're going to look at hair distribution, texture, and density, and also palpate the scalp for any ulcerations or lesions. While you're palpating, you can palpate the temporal arteries, as well as the sinuses, checking for any pain or tenderness. Next, we will palpate the temporomandibular joint. So I'm going to have you open and close your mouth. And there is no popping or clicking noted there. While still palpating, we're going to move on to the lymphatic chains. So you can palpate the preauricular, the parotid, the tonsillar, the submandibular, submental, the superficial and deep cervical chains, the posterior auricular, the occipital, and then the supraclavicular lymphatic chain. Next, you're going to palpate the trachea, making sure it is midline, and also palpate the thyroid, checking for any nodules or growths. You swallow for me. Good. And you can feel the thyroid isthmus moving up and down when she swallows. Next, we're going to move on to the eyes. So you're going to inspect the eyebrows, eyelashes, and also you can inspect and palpate the orbital area for any tenderness or lesions there. You're also going to check the lacrimal ducts for any kind of obstruction. And while you're doing that, you can check the conjunctiva, looking for pink moist conjunctiva, and also note that the sclera of the eye is white. Yellowing of the sclera indicates jaundice. Still on the eyes, you're going to assess for direct and consensual response to light. So direct, and then still looking at this eye, consensual response. To examine the ears, you're going to inspect the external ear first, looking for any abnormalities or deformities. Then you also want to inspect the external canal for injury before inserting the otoscope. You're going to pull the pinna up and back and insert the otoscope, finding the tympanic membrane, and you're looking for a pearly gray tympanic membrane with a positive cone of light. You would want to note any bulging or redness, which would indicate acute otitis media. To inspect the nose, you're just first going to inspect the outer structure, looking for symmetry or any deformity. Then you would inspect the internal nares, looking for polyps, redness, swelling, or any drainage. And hers look good. To assess the mouth, you start with the lips, checking for any dryness or cracking. You then will inspect the buccal mucosa, looking for the pink color and moisture. You would inspect the tongue. Open your mouth for me, stick out your tongue. For its texture, moisture, and symmetry, noting that it's midline. And then you would also inspect the dentition and note any dental caries, fillings, chipped or missing teeth. And she does have some fillings in there and one missing tooth from where it was pulled. Now I'm moving on to the thoracic and cardiac exam. So first you're just going to inspect the anterior chest. We're looking for symmetry of the chest movement. We're going to note the rate, rhythm, and effort of breathing. And we also want to note if there are any retractions while the patient is breathing. We're going to palpate the chest wall for any tenderness or lesions. And then we're going to assess chest expansion. So you want to put your thumbs at the costal margins here, and so your thumbs are together, and then push slightly upward, and then take a deep breath in and out. And you're watching there for symmetrical movement of your hands. Next, we're going to percuss the chest, and while we're percussing, we are wanting to hear resonance. Hyperresonance would indicate a hyperinflated lung, and dullness would indicate a fluid or a possible mass in the lung. Next, we're going to auscultate the lungs from the apex to the base. We're listening for bronchial and vesicular sounds and would want to note any adventitious sounds that we hear. Next, moving on to the posterior chest, we're again going to inspect and palpate for any lesions or tenderness and symmetrical movement. To assess chest expansion posteriorly, you're going to place your thumbs how you did on the front, but you're going to place them at the level of the 10th rib and then push up immediately. Take a deep breath in and out. And again, just watching for symmetrical movement of my thumbs. Then I'm going to percuss in the 7 locations bilaterally on the back. Again, listening for resonance and noting any hyperresonance or dullness that I hear. And lastly, I'm going to auscultate the lungs using the same lattice pattern that I use to percuss. Deep breath. Moving on to the cardiac assessment, first you're going to inspect the precordium, and you're going to want to look at all 6 areas on the chest. First, the aortic area in the second intercostal space to the right of the sternum. Then the pulmonic, which is also the second intercostal space to the left of the sternum. Then you're going to drop down to Erb's point, which is in the third intercostal space. Tricuspid area is in the fourth and fifth intercostal space. The mitral area is in the fifth intercostal space. And then the epigastric area is directly under the xiphoid process. You want to palpate the chest with your fingertips for any heaves, and then the ball of your hand for any thrill. Next, we will auscultate in those 6 areas, listening for S1 and S2 and any murmurs. You can just breathe normally for this portion. Then I'm going to have you lean forward a little bit. I'm going to listen to see if I hear any aortic regurgitation. I'm going to have you take a deep breath in and out. Okay. I do not hear any aortic regurgitation. Next, I'm going to have you lay supine for me. And I'm again going to listen supine to all 6 areas on the chest. I'm going to flip to the bell of my stethoscope, and I'm going to have you turn over onto your left side so I can listen to, can you scoot back a little bit? Scoot over this way. Sorry. I'm going to listen to the, and locate the PMI, and I'm going to auscultate this area in this position. It accentuates any S3 or S4 sounds, any mitral stenosis, or mitral murmurs. And I don't hear any murmurs there. You can go ahead and lay back on your back. Next, I'm going to inspect and palpate the carotid arteries. And I can also note in this position if there is any venous jugular distension. And you only want to palpate the carotid arteries one at a time. I will then auscultate the carotid arteries with my bell, listening for any bruits. And I do not hear any bruits there. Next, I'm going to assess the rest of the pulses on the body. So I'm going to assess here, the brachial pulse, the radial pulse, the popliteal pulse behind the knee in the popliteal fossa. Hold your foot up here. I'm going to do the dorsalis pedis pulse on the top of the foot and the posterior tibial on the inside of the ankle. You can go ahead and sit back up. Moving on now to the abdominal exam. You want to have the patient lay supine with their head on a pillow, arms at their sides, and make sure that they've emptied their bladder prior to the exam. So you're going to begin by just lifting up their shirt and inspecting the abdomen for any distension, hernias, or scars. There are none here. Then you're going to begin by auscultating all 4 quadrants. While auscultating, you're going to flip to the bell and listen to the aortic artery, the renal arteries, the iliac arteries, and the femoral arteries. Next, we're going to percuss in all 4 quadrants. Tympany would indicate gas in the colon, and dullness would indicate fluid, a stool, or potentially a mass. To percuss the liver span, you're going to start in the midclavicular line below the umbilicus and percuss up to dullness. You're also going to start at the nipple line in the midclavicular line and percuss down to liver dullness, and then you would measure that in centimeters. Next, you would percuss for splenic dullness. Percuss over here. Tympany is what you want to hear. If you actually hear dullness on that side, that would indicate splenic enlargement. Next, you're going to start with light palpation of all 4 quadrants, and you would want to note at this point any pain or tenderness to avoid hurting the patient during deep palpation. Then you will deep palpate in all 4 quadrants. Any pain?
No.
If you're suspecting cholecystitis, you want to assess Murphy's sign. So I'm going to kind of hook my fingers here under her intercostal space. I'm going to have you take a deep breath in and out. Any pain there?
No.
Any pain, or sometimes you could even feel the gallbladder come down onto the fingers, which would elicit pain in the patient, would be a positive sign for cholecystitis. Couple tests for appendicitis. McBurney's point, you go a couple of inches below and to the left of the umbilicus and press. Any pain there?
No.
Pain would be a positive test for appendicitis. The obturator test, I'm going to press down on your leg and have you lift it up. Any pain in your right lower quadrant with that?
No.
And then the obturator test, you flex the knee and the hip up and internally rotate the hip. Any pain in the right lower quadrant there?
No.
Okay. Then lastly, while the patient is supine, you're going to palpate the aortic pulsation. And have you sit up. Lastly, for the abdominal exam, I'm going to check for CVA tenderness, which would be an indication of pyelonephritis or kidney stones. I'm going to place my palm flat on her back at the costovertebral angle and strike it with my other fist on both sides. Any pain there?
No.
Next is the musculoskeletal portion of the exam. First, I would ask the patient if they have any joint pain or swelling, and then I would inspect all joints for symmetry, alignment, deformities, or swelling, arms, legs, and feet. Then I would palpate all of those same joints, feeling for any nodules or tenderness in any of them. Any tenderness?
No.
No. For range of motion of the joints, starting with the neck, we will do neck flexion, extension, lateral bending, and rotation. Shoulders, we do abduction, adduction, and can you roll your shoulders forward? Internal and then external rotation of the shoulders. For the elbow, we flex, extend, supinate, and pronate. For the wrist, we flex, extend, and then radial deviation in and ulnar deviation out. For the fingers, we flex and extend, spread your fingers apart, abduction, and back together, adduction. For the vertebrae, I'm going to have you bend forward for flexion, then lean back for extension. I'm going to have you rotate, twist side to side, and then lateral bend from side to side. Next is Kim's test. I'm going to place my palm and support her lower back and hold her to me. Then we're going to go in a circular motion around the spine and note any pain there. Localized pain would indicate a spinal facet injury, and radicular pain would indicate a nerve root injury. Next, we're going to go to the hip. So you're going to flex your hip up. Okay, then put your leg back for hip extension. Good. Then you're going to adduct your hip, so move it, or abduct, move it out, and then adduct back in. And then internally rotate your hip and externally rotate your hip. Good. For the knee, you're just going to bend and then straighten back out. And then for your ankle, you're going to plantar flex, point your toes down, dorsiflex, point them up, and then eversion, turn your ankle in. You can hold on to you if you can't balance. And then, eversion is out and inversion is in, yes. Special tests for the upper extremities, you back up a little bit, are the acromioclavicular joint crossbody test. So you're just going to bring your arm up and straight out across, and you would do that for both arms. The near impingement sign, I'm going to stabilize your shoulder here and just have you take your arm straight all the way up. There you go. And then the Hawkins impingement, you're going to put your arm up like this, and I'm going to lift your elbow up. Any pain there? No. The near impingement and Hawkins impingement test for shoulder impingements and then any rotator cuff tears. Next is the Apley scratch test. So I'm going to have you take your hand up and over and touch the opposite scapula behind your back. This is flexion, abduction, and external rotation of the shoulder. Then we're going to go below and behind, same thing. That is extension, adduction, and internal rotation of the shoulder. Next is the drop arm test. I'm going to have you put both arms out and hold them there. Watching for symmetrical lowering of the arms. Go ahead and lower them, both of them, and any weakness. Next would be the empty can test. I'm going to have you put your arms out in front of you, thumbs down, so your hands are turned all the way out, and then I'm going to push, but do not let me push them down. Good. Next is the external rotation lag test. I'm going to have you flex your elbow to 90 degrees with your palm up and move your arm away from the body and hold it there. Any pain or inability to hold this position would be a positive test. To test the wrist, we're going to do the Finkelstein test. I'm going to have you put your thumbs inside your fists and point down in ulnar, keep them turned up, like that, in ulnar deviation. Any pain here would indicate tenosynovitis of the wrist. The Tennel sign for carpal tunnel, I'm just going to have you keep your hand open and tap here. Any pain, numbness, or tingling? No. Okay, you would do that on both sides. Lastly, for carpal tunnel is the Phelan test. I'm going to have you push the backs of your hands together. We would hold this pose for 60 seconds. If there is any pain, numbness, or tingling during or after you let go, that would indicate carpal tunnel as well. Okay. Now I'm going to perform some special tests for the lower extremities. First is the McMurray test, assessing meniscal tears and ACL injury. I'm going to flex the knee to 90 degrees, apply pressure to the medial knee while holding the ankle, or while holding the heel and lowering the leg down. Any popping or clicking felt during this test is a positive test. Next is the valgus test, also testing for MCL injury. Going to flex the knee up, apply medial pressure at the ankle and lateral pressure to the knee. Any pain? No. The Varus test is the opposite. I'm going to apply lateral ankle pressure and medial knee pressure. That tests for LCL injury. Positive test would be pain. For the Lockman test, you want to flex the knee to 15 degrees. Hold your leg. And then I'm going to press down on the femur and pull on the tibia. And pain there would indicate an ACL tear. The anterior and posterior drawer sign tests assess for cruciate ligament injuries. For the anterior test, I'm going to put my hands around the back of the knee and pull forward. And then for the posterior test, keeping my hands in the same position, I'm going to press back. The straight leg test, a test for lumbosacral radiculopathy. I'm just going to lift your leg straight up and dorsiflex your foot. Any pain there?
No.
Okay. The fair test, I'm going to have you kind of roll onto your side and face me. A positive test here would be pain in the sciatic or gluteal area. So I'm going to support the knee and flex the knee and the hip up, and then internally rotate the hip. Any pain in this area?
No.
Okay. That is a negative test. You can go ahead and lay back. For the thigh thrust test, I'm going to have you, can you get your knee up on the edge of the bed here for me? I'm going to put my hand under the SI joint and thrust down several times on the knee. Any pain there?
No.
Okay. Pain would indicate SI joint dysfunction. The Fadir test, we're going to flex the hip and knee to 90 degrees. I'm going to push the knee in and pull the ankle out. Pain here would indicate hip impingement. Any pain?
No.
And the Faber test, I'm going to have you put this ankle on this knee. I'm going to press down on this knee and this hip. Pain in the groin or buttocks is a positive test there. Now we're going to do the neuro exam. First, we're going to check pupillary reaction to light. We want to note the pupil size and a brisk or sluggish reaction. Next, we're going to check the 6 cardinal directions of gaze, looking for conjugal movement and any nystagmus. I'm going to have you follow my finger. Good. Next, I'm going to assess the facial nerves. I'm going to have you raise your eyebrows, frown, close your eyes tight, show me your teeth, smile, and puff out your cheeks. Good. You can open your eyes. Testing sternocleidomastoid strength. Turn your head into my hand in this direction. Good. Next, we're going to assess the corneal reflex. So I'm going to have you look up and to the left. Good. I'm going to stand behind you now to perform the whisper test. I'm going to have you use your finger to kind of massage your ear right here. And I'm going to whisper a sequence of 3 letters or numbers and have you repeat them to me.
A6R.
Good. Next, to assess the uvula and soft palate, I'm going to have you open your mouth and say ah. And I'm assessing for symmetrical rise of the uvula and the soft palate. Muscle strength is what we're going to test next. I'm going to have you put your arms up like this. Push against me. Pull. Good. Then I'm going to have you squeeze my fingers. Good. Then I'm going to have you spread your fingers apart and don't let me push them back together. Good. And then put your thumbs up and push against me. Good. For thumb opposition. And she's a 5 out of 5 on all of her upper extremities. For the lower extremities, the legs, I'm going to have you push against me. Good. And push back. Okay. I'm going to have you plantar flex, push down, and dorsiflex, pull up. Perfect. For your biceps reflexes, or for your reflexes, first we're going to do the biceps, which is C5 to 6. I'm just going to have you relax your arm right there. Good. Then we're going to do the triceps reflex, which is C6 to 7. Okay. Then we're going to do the brachioradialis, again, which is C5 to 6. Just relax your hand. Good. Next, we're going to do the quadriceps reflex, which is L2 to 4. It's a little hyperreflexive on that side. And then for S1, we're going to do the Achilles there. And then for S5 or L5 through S1, you could do the plantar response. And you can also look for Babinski sign here. Babinski sign would be where the toes spread and fan out. She has a normal sign where her toes are curling under. Also want to check for any clonus. So I'm going to dorsiflex her foot and feel for any pulsations of her foot moving. Lastly is the Hoffman sign. Let's see your hand. Relax it for me. You just want to flick down on the middle finger, and a positive Hoffman sign, the thumb and index finger would form a circle. Lastly, we're going to assess coordination. So first I'm going to have you take your heel and run it down from your knee to your other ankle. Good. Now we're going to do the Romberg test. So close your eyes and just try to stand still for me. I'm watching for any swaying here. Next, I'm going to have you do the finger to nose test. So put your arms out to either side, close your eyes, and then just touch your nose one at a time and go back and forth with each finger. Good. Next, we're going to assess for pronator drift. So with your eyes still closed, hold your arms up like this. And we would maintain this position for about 30 seconds and watch for any arm drifting down would be a positive test. Okay, next we're going to assess your gait. So I'm just going to have you walk across the room for me. Okay, then I'm going to have you walk back on your heels. Good, then walk back again on your toes.
I can't hardly walk on my toes, my foot's stiff.
Okay, then I'm going to have you walk heel to toe back the other way, like that. Okay, next we're going to do rapid alternating arm movements. So I'm going to just have you tap your hands back and forth and flip them. Good. And then rapid finger tapping, if you can just tap your index finger on your thumb. Good. And that is the conclusion of my physical exam competency.